So why should pathologists use Twitter and Facebook and other social media? Hopefully at the end of this presentation you'll understand why I use social media, and hopefully all of you will be inspired to do the same. But first I have to say my own thanks to Eduardo. Eduardo was one of the first pathologists from Spain who I met online, and through interacting with him, I came to meet many other wonderful pathologists here in Spain, which has been really great, and it's been a wonderful experience to get to know all of them. And he has been a wonderful ambassador for your country to the United States and around the world. Everybody on Twitter knows who Eduardo is. It's true. And it's been really great. We're both ambassadors, so it's a title that we both share for USCAP. I'm the ambassador for the United States, one of the ambassadors, and Eduardo, ambassador for Spain. So, los dos embajadores. Okay, so Eduardo also is, for Twitter, for pathologists in Spain, he is the jefe. Claro. Y el rey. Los dos. So Eduardo is an awesome guy, and I'm really happy to know him. And he drove 3 hours from Murcia to Granada to pick up me and my wife and bring us back to Murcia and give us a tour and lots of jamón. And so I'm very happy. Me encanta jamón. Raise your hand if you use Twitter. Good. It's the best audience I've ever spoken to. I'm very happy. How about Insta? Good. Okay. Facebook? Snapchat? Yeah, I know. My medical students use all of them use Snapchat. And so I started trying Snapchat because if the kids all use it, I should learn too. It's very hard. How about if you don't know what any of those strange symbols mean? It's okay, you don't have to type. If you don't use Twitter yet, you can take out your phone right now during this talk, and you can download and install Twitter, and then you have permission to play on your phone for the rest of the lecture. See, no one ever tells you you're allowed to do that, but I'm saying it's okay. If you want to be on your phone during the entire lecture, it's okay. Just let me in. And once you start using social media, whenever you're in a meeting, your department, I'm always on my phone. No one ever wonders what I'm doing. They're like, oh, Jared, he's tweeting, it's okay. It's market research is what I call it. And then also, you'll see down here, I still use email. So if you're old school, you can email me. And there's a social media guide for pathologists. This will be up during the whole talk. And this tells you everything that you need to know about Twitter, Facebook, all of my advice on how to use social media professionally. And then I also have, you can follow me over here on Twitter, Instagram, all those things. And that's my username, and then here's the hashtag for the meeting. And whenever I give lectures at meetings, I always do this. I put my username and the hashtag for the meeting. The hashtag is, for those of you who don't know, this is a way that if you click on that hashtag on Twitter, you can see all of the tweets about this meeting. So it's really cool. It's an easy way for people. There are people right now in the United States and India and other countries around the world following what's happening here in Valencia because of the hashtag and Twitter. And then after the meeting, we can find out statistics about how many tweets there were during the meeting, which is really cool. And that's the social media guide for pathologists, so you can just Google and you'll find it. It's very easy. So we talk about social media. Many of you use social media, but what is it? How do you define social media? I think this most simple way is that social media are websites that allow users, individuals, people like you and me, to create and exchange content. Now that content can be a lot of things. It might be pictures of what you're eating. Me encanta jamón. Let's try that. And then look, a lot of my friends like jamón too. There's 109 people. I mean, it's beautiful. Okay. Or Alhambra. Or I spoke at my medical student's graduation last week just before I came here to Spain. And so you can share whatever kinds of things are happening in your life with your friends and family and your colleagues on social media. This is mi niñitas, Bella, Becca, Gavisita. And my wife was behind taking the picture and keeping them. We put them in place, give them food, and then hurry, 1, 2, 3, picture, and then before they started screaming. So a lot of hard work went into that picture. And it was mostly because of my wonderful wife. But there are other types of content you can share on social media also. Pictures of Wagner-Meissner bodies. Beautiful, right? Melanocytes. That's a tick. I don't know how you call it in Spain, but they bite you and suck your blood. So we have many of them in the United States. Or artistic things like that. That's the starry ovary. That's ovarian stroma. Oocytes. Van Gogh. And Ivar Hista is an amazing guy who's an artistically minded histology professor from the US who makes a lot of cool stuff like this. And this helps his students to understand the beauty and the art behind what we do in histology and pathology. It makes histology more accessible to people that otherwise might not have appreciation for. Or this is my, because it's a Vader Pacinian. Vader, Vater sounds like Vader. Or my baby. On top of the books of my favorite mentors, Sharon Weiss, Ron Rapini. And there are famous pathologists on Twitter also. I'm not the only person. This is Laura, Eduardo, Steve Billings, Sharon Weiss, Chris Fletcher. More and more pathologists are sharing content, useful pathology information using Twitter and other social media, and are realizing that this is a new way to interact with and teach and learn and network and to exchange ideas around the world. This is something that all pathologists should be doing, I think. So social media is just like other types of media, but the difference from a TV station or a newspaper or a regular website is that you are the editor. You are in charge of whatever content you put on your social media channels, whether it's Twitter, Instagram, or Facebook. And the infrastructure, the way that social media platforms like Facebook or Twitter are built, allows interactions between people that resemble real life. Which is why when I first met Eduardo last year at SEAP-IAP, I felt like I've known him for a long time. And many people here in this audience who I met here for the first time 2 days ago, but I felt like we were old friends because we have interactions that are just like real world interactions. Just because it's through a phone, does that make it any less real? There's still a human being on each side that are connecting and having a discussion. And that's why social media is so powerful. It's that interaction between two people or a group of people that makes social media powerful. It makes it so much more powerful than regular media in the past. It doesn't replace real life relationships, but it does augment them. It helps them when distance or time separates you from the people you care about or want to interact with. Social media can overcome that. I can have an ongoing discussion with someone in Spain or Nepal or India, even though we might never see each other or only once every few years, but we can talk every day on social media about pathology, about life, about whatever. And that is really cool. So the interaction between users, that's the key. That's what makes social media social. So pathologists can use social media in a lot of different ways professionally. I try to do all of these things and more, but this is a big part of my job now. I give talks about social media like we're doing right now. I write papers about social media. This is a large component of my professional and academic activity. You may not need to do all of this. You may just want to work with the patient group. You may only want to tweet interesting cases. You may only be interested in using it for keeping up with the literature. Whatever you want to do with it, that's fine. But social media can be used for a large number of different things for pathologists. So here's an example. Here's a chondrosarcoma growing off of an osteochondroma. So I can share that picture on my public Facebook page. So this is different from, I have a personal Facebook for friends and family. And many of you, if I've met you, I'm happy to be friends with you on Facebook and let you see my kids and the hamon that I ate last night. But I also have a public page where I share mostly just medical content. And this is public, so anyone in the world can see it, which is good. So that way I can have my friends and family posts, and then I can also have public information about medicine. And that way it kind of makes a kind of a privacy barrier, which is really convenient. And people can then, if they like this post, they can share it with all of their followers or their friends on Facebook. So it's really useful. And also Facebook pages. I think Facebook pages are really important, and a lot of people say, I don't really like Facebook, and the difference is that you have to have a page. A public page makes all the difference in the world in making Facebook use successful on a professional level. And that's because it's public, but it separates it from your private life. And also, pages tell you things like this. Look, 23,000 people saw posts this week, and this was a long time ago that I took this picture. So now I'll post, and in a week, 50 or 60 or 70,000 people might see my posts in 1 week. It's amazing, right? It's not because I'm amazing, it's because I'm using a tool that's very, very powerful. It's free, and it's available worldwide. And when you share information, sometimes I'll say, oh, look, here's how you can tell. That's a melanocyte because the cytoplasm clusters to the nucleus and leaves a space around the outside. That's what melanocytes do. Keratinocytes get naked nucleus, and the cytoplasm stays to the outside. So that's a useful little tip. But look, 10,000 people saw that post and thought, this is cool. You can share any type of little thing that you might teach your resident or share with someone in your lab. You can take a picture of that and share it on social media. And you might think no one cares. Well, 10,000 people care that that's a melanocyte. Because one day someone is going to be looking at a slide, and they're going to have to decide, is that a melanocyte at the margin or not? So one day a patient's life or a patient's margin or whether or not they undergo more surgery will depend on tiny little bits of information like this. So sharing those things over time, and I've now heard many people from all over the world have said, oh yeah, I saw your post and then I had a case like that and I was able to diagnose it correctly. And that's why I keep using social media, because it helps real people in real life, and that's what really matters. That's why all of us are in this room, why you're here instead of out enjoying Valencia, because you want to learn about how to help patients, right? That's why we do our work. And sometimes I post funny things too. This is a mitochondria, is a Mother's Day card. It said, Mom, you gave me something that Dad never could. It's pretty clever. And it's not even mine, it was from this website. So see, I posted the source, but look how many people, 4,900 people liked it. There were 17 people who didn't like it. I don't know what's wrong with those people. But the nice thing about Facebook is that it tells you all this kind of analytic information. So when you post, you can see how many people like your post or not. How many likes you get doesn't matter, right? It's not about the number, but when you're a teacher, an educator, you want to know, is the content that I'm sharing useful to my learners, to my students? Do people like this? Is it useful to them or not? And when we teach students, at least in the United States, we always have them fill out little forms. And they'll forget, and they'll say, oh, I don't remember. Dr. Gardner he was okay, I guess. But this is actually real information that I can use, and they don't have to remember to type it in. Facebook tracks all of this information and aggregates it and gives it to us when you have a page. So your personal Facebook account won't give you this when you post, but a professional page, which is free, it will give you all this information. And here's another view of the same thing. You can see how many people have seen your video or whatever on your page. So I use this sometimes not only for cases, but say I publish a new paper. I wrote this paper with Nicole Riddle, a friend of mine. Many of you may follow her on Twitter. And it was about new soft tissue tumors. And we published it in a really good journal, Surgical Pathology Clinics, but that journal is not read very widely. It's a great journal, but not a lot of places have a subscription to it. And what we did is we took a picture of one of our tables. We had a table of all the new molecular findings. And we shared that on Twitter, and look, 73 people retweeted it, and within like 1 week of publishing, 7,000 people had seen. They may not have all read the paper, but they all knew that we had published a paper about this, and they could see, oh look, there's a paper about new soft tissue tumors and new molecular findings. I mean, this was before the paper was even in print. And I've done this since to even greater effect, and it's really a great way to share the kind of work you're doing, what you're publishing. Whenever I put a new YouTube video up, I share it on Twitter and Facebook, whatever kind of material you're already making for whoever your students are. You can share that same kind of information using social media, and you can share it more widely than you would ever be able to otherwise. This was a big turning point for me, October 2013. I had wanted to make either a website or a blog, something to share and teach about dermpath and sarcoma pathology. And I thought, that sounds too complicated. Maybe I'll just make a Facebook discussion group and, invite a handful of my colleagues that I know, and we'll talk about cases. So I created these and they exploded. People from all over the world started joining. Within a couple months, there were like 5,000 members in these groups. And now, less than 4 years later, the DermPath group, I think, has 25,000, and the soft tissue group has 18,000 members. Now, not all of those members are active or participating, but there's an enormous number of people there. Hundreds and hundreds of teaching cases have been posted in these groups and discussed. So once I saw that, I realized social media is important. People care about social media, and I need to spend more of my career and my effort doing this. So here's the bone and soft tissue group, and I actually have a little editorial board that helps me organize and keep spam out of the group. And here's an example of my friend Sandhya from India. She posted an example and said, well, is this atypical lipomatous tumor? Is this something else? And then we all posted comments and had a discussion. But look at this, 84 comments. A back and forth dialogue about a fatty tumor on Facebook generated 84 comments. This is the kind of discussion we're supposed to have at meetings, right? Like this. After someone talks, to have someone get up and we exchange and we talk. But we can't because there's never enough time. But Facebook solves that, right? We can have an ongoing discussion. And say 3 years from now, someone invents some new marker about a case, a new molecular finding. I can go back and we can pull that old post up and we can say, hey, look, there's a new fish finding, and I bet that this is this new entity or would be positive for this new marker. So we can have this ongoing kind of discussion even years down the road from old cases. It's a very robust way to learn and to discuss pathology. We also do an online journal club on Twitter. Sounds kind of crazy, right? But other fields have been doing this successfully. Urology and nephrology and some others as well. So we started last summer a pathology journal club that we call PathJC. Now, unfortunately, it takes place in the middle of the night for all of you here in Spain. We do it in the evening in the US, so it's probably 3 in the morning here, I think. But if you're really hardcore, you can wake up and participate with us. We will give you awesome props for that. We'll say, the Spanish pathologists are amazing. You can go out and go to the club for a little bit and then go and tweet about pathology. We've been doing this now since last summer, and we actually had a poster about it at USCAP this year, and it's been so successful that we decided to actually, another group of us, we decided to make a DermPath-focused journal club. So I anticipate that there will be more and more of these over time. We pick an article, and then 1 day per month we meet for an hour and discuss. So even if you don't want to wake up in the middle of the night to do PathJC or DermPath Journal Club, you can wake up the next morning and click on that hashtag and see all of the tweets, and you can still add your comments, retweet, discuss, and still participate in the conversation. So this is the social media subcommittee for the American Society of Dermatopathology, which is, I'm the chair of that committee. So our committee decided that we wanted to create the DermPath Journal Club, and we've had 2 meetings so far, and it's been very successful. And I also use YouTube, so you can, if you teach, you can take a video of it, hook up your iPhone to your microscope and hit record and say, hey, here's how you diagnose multiple myeloma or GI pathology, whatever. So maybe you're not comfortable doing that in English. That's okay. There are lots and lots and lots of Spanish-speaking pathologists around the world who care what you have to say and could happily learn from you and help their patients. So if you want to do videos in Spanish, that might be really cool. I don't think there's anyone out there doing that on YouTube that I know of. Maybe one of you will be the first. It's real easy. Make the video, upload it, tweet about it. Pretty soon you'll have people following you and watching your videos. In 2015, I helped organize a group of in situ pathologists. We called ourselves a live tweeting group for the USCAP annual meeting, similar to what Eduardo and many of his colleagues have done here at SEAP-IAP. And so this was a couple years ago we started this. Right? I tweeted and said, hey, let's make a live tweet group. And we got together a group of, I think, 23 of us. And USCAP liked the idea and they thought it was cool. So we live tweeted at the meeting. And we had an enormous number of tweets. Almost the first day, I think we had over 1,500 tweets about the USCAP meeting. And you can see there's a website called Simpler.com. And Simpler allows you to track how many people are mentioned, how many tweets, how many impressions, which on Simpler, these are potential tweet views. It's kind of complicated. But anyway, there were 6,000 tweets and 658 people participating in discussions about the USCAP 2015 annual meeting. So I shared this information with the leadership of USCAP, and a few days later they called me and said, we want you to create a social media committee and run social media for USCAP. And the meeting now, in 2017, I think we were, I can't remember, 30,000 tweets. It's grown a lot, but what I think is really cool is look at your numbers from this meeting. Here's SEAP 2017V, and you have 4.9 million, 3,700 tweets. You are almost caught up to USCAP, which is an enormous, huge meeting, 5 or 6 times bigger than this meeting. And yet here you are, you're almost caught up to where we started with USCAP. So Spain pretty soon is going to rule the world on Twitter. And Royal will be the king. So it's pretty cool. And look at the people. Laura, Tanya, Rita, Raquel. I mean, a couple of these people are residents, and yet they're among the 10 most mentioned and influential people on Twitter at this meeting. I think that should speak very strongly to the current leadership of pathology in Spain and around the world, that if we don't get everybody involved, the more junior people are going to eventually be in charge of everything, which is cool and great if you're a junior person, right? But we need mentors to be on Twitter too, and to be participating and having a voice here. But I think this is just a sign of how very powerful these tools are. And I know all of these people, and many people in the US know them because they tweet. I would never have met any of you in this room, and I wouldn't be here speaking if it wouldn't be for a small group of people in here that have been active on Twitter that made me realize, wow, there is a very strong social media community of Spanish pathologists, and it's been really great to see that. And it's not only sharing information and teaching, but you can actually have professional collaboration, publications, even research that is performed with the help of social media. So Keisuke Goto is one of my friends from Japan, and he posted this beautiful case. Does anyone know what this is? It's not something we've probably ever seen in Spain, because we rarely see it because this is sparganosis. It's a worm that gets in your skin from eating like raw frogs or snakes, which most of us don't do. So anyway, this is a really cool case, and I said, Keisuke, we should write out a little case report and publish that. So we did, and it got published, and Gina Johnson, who was the first author, she was a resident at Emory University, but now she's my DermPath fellow, so it worked out pretty well for her. And I published, so we had Atlanta, Georgia, USA, Little Rock, Arkansas, USA, and Japan. And none of us, I had met Gina, but none of us had met Takao or Keisuke ever before, and yet we wrote a paper together across 10,000, 15,000 kilometers because of social media. See, social media is bringing the world of pathology together in a way that has never happened before in the history of the modern world, and it's really cool. And so it was by a cool glitch of the publisher. Actually, our case got published on the cover of the Journal of Cutaneous Pathology not once, January 2015, but also twice, March 2015. They accidentally published it 2 times. So I think this might be a first in the history of pathology publishing. And I only put it in my CV 1 time, but I did say, see also the March edition. I was pretty happy about that. It was cool. All right. Another thing that I've done that Eduardo mentioned is I've worked with sarcoma patient support groups, mainly on Facebook, because that's where these groups exist. These are discussion groups that are founded by patients, and that patients and family members join to discuss and learn information about their rare cancer. Because many of these people, if you go Google sarcoma, well, there's a lot of different sarcomas, right? And they're all very, very different from each other. And it's hard for a patient to understand that myxoid liposarcoma and well-differentiated liposarcoma and pleomorphic liposarcoma are all very different tumors that behave differently, potentially receive different treatment. But to a patient, I mean, all these omas, it's hard enough for us as pathologists to keep track of, right? It's difficult. So these groups are a wonderful place for the patients to learn from each other. And I joined a few of these groups starting in 2014. And this lady right here, her name is Pip. She lives in the UK. And she had a DFSP, dermatofibrosarcoma protuberans, on her forehead. So DFSP doesn't usually kill patients, but it's incredibly morbid because it results in huge scars that are very deforming. She's had 15 surgeries over the past 20 years. She's still having surgical reconstructions because of pain and issues she's having with that site. And when I joined the group, I said, well, I'm a doctor. I don't know if I'm even allowed to be in this group. And Pip said, This is amazing. You're the first doctor, the first medical professional who's ever joined our group in 6 years that she had created it. I was the first person to ever join and ask, how can I help you as patients? And that was a very emotionally moving moment for me to realize these people here, they just want help and there's no one out there to help them. And I think that most doctors don't even understand that these groups exist. And I've joined many groups since, and it's been really a really cool experience to meet these patients and to understand what it's like to be on the patient side. Isn't that what your motto for the SEAP organizations, right? That the patient is the center of what we do. It should be the motto of every pathologist, of every doctor in the world. The patient is everything. And so to be able to interact with patients, even though they're not my own patients, has been really a wonderful experience. It's made me a better doctor. And here are some of the groups that I've been a member of and interacted with. I mean, look at that, 2,200 angiosarcoma. You can go to the largest cancer centers in the world and they will not have access to 2,000 angiosarcoma patients and family members. These are powerful groups, and we as physicians, I think, are missing out on many opportunities we have to learn from these patients, to educate these patients, to advocate publicly on their behalf, and even to use them as a powerful source of enrollment for research trials. So I've given a lecture about this. If you're interested in my work with sarcoma groups, you can watch this. It's on my YouTube channel, and I talk in more detail about how I've worked with these groups. And what was really cool is after I posted this, you may have seen this book before, Emperor of All Maladies. It's a wonderful book by Siddhartha Mukherjee. He's an oncologist, and he wrote a book about kind of the history of chemotherapy and cancer treatment. And it's been turned into a TV series in the US. It's really wonderful. But he just joined Twitter not too long ago, and he actually tweeted a link to my talk. So that was a pretty cool day for me. I added it to my CV, actually. It's true, I actually did. And like I said, it really has changed my life. I've met some of these patients, and you can read this as an article I wrote in this book, The Healing Art of Pathology, and then also we published it as an excerpt in the Archives of Pathology. But it explains why I feel so strongly about these groups, because getting to know these patients, even ones who have died or their family members of sarcoma patients who have died, being able to tell their story as a physician brings a lot of healing to the family members, to know that their loved one who passed away, who died from this bad tumor, that some good is coming from the terrible suffering that they went through. It's been very moving to me, and I've met many of these patients in real life, actually, and it's been a really incredible experience. Now, what about research? We can actually do real research with these groups. One of my medical students, Jasmine Holler, who's really fantastic, she approached me and designed a research study with me a couple of years ago, and we surveyed these sarcoma groups to ask them, how do you feel about pathologists? What do you think pathologists do? Do they do autopsies? Do they diagnose cancer? What do they do? And we asked them some questions, and we also asked them, do you like having a pathologist in your group? And to the groups that didn't have a pathologist, do you want to have pathologists or other doctors join your group and interact with you there? And we got 541 patients and family members also, but mostly they were patients, to respond to this survey in 3 weeks. 3 weeks, 540 patients and family members with rare, very rare tumors responded to a survey about how they feel about pathologists. I mean, this kind of research has never been performed before, to my knowledge, and it cost us, I think, $75 US to buy the extra SurveyMonkey account to get some extra analytic data. Pretty powerful. I don't think any other cancer center in the world could get that kind of data in 3 weeks for almost no cost. And what we found is that the groups that had pathologists involved versus those that didn't, they all thought pathologists were an important part of patient care. But there was a little difference. And I was surprised that when we calculated the p-value, it seems to be statistically significant. So pathologists being involved with patient groups helps patients to realize that we are important for patient care. I think that that's something that our specialty needs, right? To have public awareness of what we do and why we are so important in the care of patients. 90% of them said that by pathologists posting in the group, it helped them to understand their disease. And 98% said that overall it was a good thing to have a pathologist in the group. Patients are okay with this. They want us to participate. You might be afraid. You say, well, what if they ask me, how should I be treated? I tell them, I'm not an oncologist. I don't know about about chemotherapy, but here are some questions that you should ask your doctor, your oncologist, or your surgeon. We can help these patients navigate the confusing language of medicine and the confusing path that cancer patients take once they're diagnosed and enter the medical system. We can help them to better understand and be empowered to know about their disease and to speak with their physicians in a very cognizant and intelligent way. And I think that this is an important role for us. We've done other actual research that's patient-centered. We received a $50,000 grant to study DFSP patients and via survey. And what was really cool about this is we actually had 5 different patients, DFSP patients, that were research partners. They helped us design the survey. They did IRB ethics training, and we are in the process of publishing these papers now, and they are co-authors. DFSP sarcoma patients who share the author line right next to my name. And to me, that's one of the proudest moments of my career so far, to have my name published next to patient name, joining with them to do research about their own disease. Very cool, very amazing. And we wanted to go a step further, so we actually, we had 200 and some respond to that survey. So what we did is we got IRB approval to do a large prospective study of DFSP, to follow them and to enroll them from Facebook and see how does their tumor behave at 5, 10, and 15 years. The patients were the ones who asked us to do this research. They said, please research us because there are so many of us here. Answer these questions that we don't know about our sarcoma. And we think that it may have the potential to be the largest prospective DFSP study ever performed. We're currently enrolling patients in the process, and it's going to take many years, but I think it's worthwhile effort. And we are allowed to follow up with that via Facebook. Because think about it, patients, at least in the US, sometimes they move to other cities. If you call the doctor and say, how is this patient doing? They say, I don't know, they moved somewhere else. And they're lost, and the information, the data is gone. But everyone at Facebook is forever, right? Everyone changes their phone number and moves, but we'll just send them a message on Facebook in 10 years and say, how are you? Did your tumor come back? Are you doing okay? And we can get that kind of information much more easily than in the past. So you can use social media to promote your department, your organization, your society, your medical journal. And these are some of the different accounts that I've helped to create and manage for a variety of different institutional departments, for local medical societies, medical journals, and many more that I've participated in. And these are great things. So for you junior people here, when you gain skill with Twitter and Facebook, big organizations will ask you to help them because the people that lead those organizations many times don't know how to do this. So this is a skill set that's actually valuable for getting potential career opportunities. It's made my career in a few short, I've only been in practice 5 years. I don't deserve to be giving lectures in Spain and being on editorial boards. I haven't really earned that, I don't think. But because I know social media, that's what's opened those doors and those opportunities for me. I lead, like I said, USCAP, social media, and American Society of Dermatology. And also I'm a deputy editor-in-chief of Archives of Pathology. And I'm not saying all that to brag or to be arrogant, but I'm saying that is why, junior people, this is why you should be doing this. And mentors in the room, leaders, teachers, you should do this so that you can encourage your junior people, your students and residents, that this is how they should be investing in their time. They may not listen to me, but if you're their mentor, they will listen to you. And if you're not using social media, it will be harder for you to know how to give them advice about social media if you haven't used it yourself. I've published a lot of papers now about social media and have quite a few more in the press that are on their way. I've given 30-some lectures, I've given courses at USCAP. I mean, all this stuff, again, these are the kinds of opportunities that social media can generate for your career. So you might say, well, it's a waste of time. I don't think so. Not a waste of my time. I'm here in Spain getting to enjoy a beautiful meeting and meet wonderful people, all because of Twitter and Facebook and that guy over there, which I'm really thankful for this opportunity. And I even actually went up for promotion and tenure in my university last year. I'm an assistant professor and I applied to become associate professor, the next level up. And at least in the United States system, part of your role for getting promoted is that you have to have excellence in a couple areas: leadership, administrative activities, teaching, patient care, and research. So I surveyed my followers and asked them, how would you rate me in these kinds of categories to get some actual real objective data. So I set a survey out on SurveyMonkey, and so here's one example. How would you rate my teaching skills based on my social media post? I received 1,100 responses to my survey in 5 days from 88 countries around the world. And most of the people said I was good. There were 3 people that said I was very poor. You can't please everybody. But I submitted, and I asked them to leave a free text comment about, what would you leave some feedback about my teaching? And it's really touched me because many, many wonderful comments from all over the world about how what I was doing was able to help their patients. And it's not just me. This is true of any of you who are doing social media. This is how your colleagues around the world feel about what you're posting, This is what matters to people. And this is why we do this. Not just to get big numbers and impressive data to get promoted, but because it really has an impact on other people. But I did submit 20 pages of comments with my promotion and tenure packet to my university. They still promoted me. They didn't fire me, so that's good. But the real reason that I use social media, the thing that really matters to me, is the people. Life is all about relationships and people, and our careers are about the same thing. And when I met all of these people, I think other than Eduardo, I've never met any of them before. But I felt like I've known them for years, and do you think I'm not going to go out of my way to help if one of them wants to come to the United States and do a rotation, or get help getting connected to somebody else for research? I will go out of my way to help any of these people, because I feel like they're not just my colleagues or my followers, they're my friends. And I feel they've been wonderful ambassadors on behalf of the whole community of pathologists in Spain. I feel very strongly invested in this whole country and pathology in this country because of these people right there. So you can thank them for that the next time you see them. They've made an impact. They maybe didn't realize it, but they have. And also Portugal as well. Whatever we're trying to accomplish as pathologists, I think that social media can help us do it faster, better, more efficiently than we could do without social media. It doesn't replace what we're already doing. It just makes it so much better. And our generation is on social media, and the senior generations, the leadership of pathology needs to be here too, so that they can pass on the knowledge and experience that our generation will need to be the future leaders of our field. Thank you. I'm not sure if we have time, but if we do, I'm happy to take any questions. Questions?
I'm the Portuguese resident. I want just to make a comment. If I'm here today, it is because of social media. And I wanted to take on your last comment and say we do need our mentors in social media. It has been so much fun for me. I have learned a lot, but sometimes I do feel a little bit lost, and sometimes I do feel like our mentors should be also commenting and also sharing. But it is amazing. For all of you that are not yet on social media, please do join.
Any other questions?
How much time it takes to do daily?
The question is how much time does it take to do social media? The question, I guess, probably should be divided. How much time does it take for me to do social media versus normal people? I spend a large amount of time doing social media, but I speak about it all the time. I write papers about it. I run social media for multiple organizations and journals. So to me, this is a large component of why I'm well known and why I'm, of my actual professional work. Some days when I'm busy, and when I was getting ready for this trip and trying to sign out all my cases, I didn't check Twitter for, a couple minutes maybe. For me, that's really good, okay? But I think that honestly, an honest answer is I think you can be successful with social media with maybe 5 or 10 minutes a day, honestly. And when you're busy, you don't have to. I do use social media a lot more than that, but again, I'm doing a lot of stuff. I'm trying to do everything, which is probably unwise, but I'm trying anyway. But I think that with just a short amount of time, and that's the thing is, it has been more efficient use of my time for my career than any paper I have ever written. And I've published like 70 papers. I mean, I publish quite a bit, 10 or 15 papers a year some years. And I mean, I'm active, I give lots of invited talks, so I'm doing the other things that I'm supposed to be doing in my career. But this has given me more mileage, more success than anything else I've done. And I think it really has more real world impact. But I think with 5 or 10 minutes a day, honestly, I think you can be very successful and be able to participate and learn. And then you can, you know, when you have more time on your hands, you're waiting for an airplane in the airport, tweet a little bit. When you're really busy and you've got a lot of cases, when I'm at work, my phone goes down. I don't check my phone. I'll take it to take pictures sometimes of cool mitoses or whatever kinds of things I'm seeing under the scope. But I don't tweet when because it's just, I need to be there to take care of patient care stuff. So I think that's the nice thing is you can, when you have more time, you can use it more. When you have less time, you can use it less, and it's okay. Great question. Yes, sir. All right, wait for the microphone.
Just a question. Do you think this social media will change the academic medical journal? Because at this moment, if I have an nice case, an university case, I feel more prone to post it and send to my friends and waiting, getting his reports and into a journal, and takes a lot of time, and I feel I don't have this kind of feedback that I can have this way.
That's a great question. The question is will social media change the way that we handle cases in academia as far as, you know, maybe it's easier just to tweet it than to actually write a case report. So far, at least in my experience, I think people are still very interested in publishing rare cases. But, you know, there are many cases we see every day that are really cool and interesting and educational, but that are not really reportable, right? It's already a well-described entity, but this is a very classic example. So those kinds of cases are great material to tweet, right? Here's a perfect example of porokeratosis or whatever GI thing you're into, and you can share that. Now, if you think it's something really rare and you want to write it up, I usually won't tweet those. I'll keep that, and then I'll write a paper, and then once I publish the paper, then I'll share the pictures, and I'll say, what's your diagnosis? And I'll let everyone guess, and then a few days later, I'll post a link to my paper and say, here's the diagnosis. We published it, and here's what it is. So see, you can kind of publish and then still use for social media. You have to have a little bit more patience to do it that way. But I don't think it will greatly change that. I think there will still be people who want to publish in the literature. And honestly, we probably could, the literature would probably be better if we had fewer case reports and more big research studies. So maybe it would be a good thing for people to tweet more case reports and only write big papers. But I don't think that's happening anytime soon, probably. Good question. Thank you.